హలో aspirants, వెల్కమ్ టు ఫార్మసీ యూట్యూబ్ ఛానల్. సో ఈ వీడియోలో మనం సెరటోనిన్ దానికి సంబంధించిన డ్రగ్స్ వాటి క్లినికల్ అప్లికేషన్స్ తెలుసుకోవడానికి మనం ప్రయత్నించేద్దాం. అండ్ ముందుగా మన ఛానల్ అయితే సబ్స్క్రైబ్ చేసుకోండి. డెఫినెట్ గా ఫార్మా కాంపిటేటివ్ ఎగ్జామ్స్ ఎవరైతే ప్రిపేర్ అవుతున్నారో ఫార్మసీ సంబంధించిన థియరీ కావాల్సిన వీడియోస్ ఎవరైతే చూస్తున్నారో వాళ్ళకి ఖచ్చితంగా మన ఛానల్ హెల్ప్ చేస్తుంది. డెఫినెట్ గా సబ్స్క్రైబ్ చేయండి, మీ ఫ్రెండ్స్ కూడా షేర్ చేయండి. వీడియోలోకి వెళ్తే కనుక సెరటోనిన్ is also one of the neurotransmitter in the body in case of both the central nervous system as well as the peripheral nervous system. Central nervous system as well as the peripheral nervous system. And the serotonin. Serotonin is biosynthesis by using amino acid tryptophan. And there are seven types of serotonin receptors present in the body, like 7 types of the serotonin receptors. Among that, 7 types of serotonin receptors, serotonin type 3 belongs to ion channel receptors, and remaining all belongs to the G protein coupled receptors. Especially activation of ion channel, that is serotonin type 3 receptor, produce vomiting. That's why selective serotonin type 3 antagonists are for treatment of vomiting. Okay, let's see in a glance. First, serotonin type 1 receptor. Serotonin type 1 receptor generally located in the central nervous system, and agonist buspirone. Buspirone is a partial agonist on the serotonin type 1 receptor. Buspirone is a partial agonist of serotonin type 1 receptor and helps in the treatment of anxiety, used as an anxiolytic. And triptans, example like somatriptan. Wherever you got a triptan, and before that somatriptan, rajitriptan, whatever it may be. Somatriptan, all triptans for helps of treatment of migraine triptans. And serotonin type 1 receptor antagonist ergotamine blocks the serotonin type 1 receptors and may act as an antagonist or partial agonist at all subtypes of serotonin type 1 and helps in the treatment of migraine. Triptans agonist on serotonin type 1 receptor for treatment of migraine. Ergotamine a ergot alkaloid antagonist on serotonin type 1 receptors for treatment of migraine. Next, serotonin type 2 receptor present in the platelet, smooth muscle, cerebral cortex, and also fundus of the stomach as well as choroid plexus. Serotonin type 2 receptors involves in the formation of cerebrospinal fluid in the choroid plexus in the brain, and especially ketanserin. Ketanserin is an antagonist of serotonin type 2 receptor and used as an antihypertensive. Ketanserin, antihypertensive, block the serotonin type 2 receptors. Ciproheptadine. Ciproheptadine, a antihistamine as well as anti-serotonin drug. Ciproheptadine is a drug of choice for treatment of serotonin syndrome. The excess serotonin in the brain can be decreased by ciproheptadine. And the serotonin type 2 receptor blockers are also used as antipsychotics like clozapine, olanzapine, risperidone, paliperidone. All second generation antipsychotics can block type 2 dopamine receptors as well as can block serotonin type 2 receptors and helps in the treatment of psychosis, also known as schizophrenia. And next, serotonin type 3 receptor blocker. Serotonin type 3 receptor is the only receptor from the serotonin receptors belong to ion channel receptor, and stimulation of the serotonin type 3 receptors produce the vomiting. That's why serotonin type 3 receptor antagonists are anti-vomiting drugs, decrease the vomiting. Serotonin type 3 present in the CTJ, chemoreceptor trigger zone. The zone triggered by our chemical substance and drugs produce the vomiting. And CTZ is present in the area posthuma, the exact location in the brain area posthuma. ఈ విధంగా కూడా మీకు క్వశ్చన్స్ అడిగే ఛాన్స్ ఉంటుందండి. వాట్ ఈస్ ద స్పీచ్ ఏరియా? దట్ ఈస్ బ్రోకాస్ ఏరియా. BROCAS. Broca's area is speech area in the brain. And vomiting center present in the area posthuma, that is CTZ, chemoreceptor trigger zone. And especially drugs like ondansetron, all cetron, SETRON, like ondansetron, granisetron, balonosetron, all cetrons selectively blocks serotonin type 3 receptors, helps in the treatment of vomiting. Helps in the treatment of vomiting. So vomiting is produced by drugs or anything. And there are selective serotonin type 4 agonists like metoclopramide, procalcitonin, cisapride. So all these selective serotonin type 4 receptor agonists are known as prokinetics. Helps in the movements of GIT. All these are known as prokinetics. Promote the peristaltic movements. Increase the gastric movements of GIT. Promote the peristaltic movements. Promote the peristaltic movements. So this is simply about what are the serotonin drugs like serotonin type 4 receptor agonist or prokinetics increase the gastric movements and the serotonin type 3 antagonist helps in the treatment of vomiting and selective serotonin receptor 2 serotonin type 2 receptor antagonist ketanserin a antihypertensive cyproheptadine helps in the treatment of serotonin syndrome and also especially the antipsychotics, second generation antipsychotics block serotonin type 2 receptor, helps in the treatment of psychosis. Both the positive symptoms, negative symptoms of psychosis are schizophrenia. So for detailing pharmacology of antipsychotics, I think you can find the video in our channel also. So this is simply regarding the serotonin and its drugs and its applications. And as you know, serotonin is a one of the autopoid as well as one of the basic neurotransmitter in the body, in the periphery as well as central. So there are seven types of serotonin receptors and all belongs to G protein coupled receptor, exception serotonin type 3 belongs to ion channel receptor.